സ്റ്റാർട്ട് പറയൂ. I'm changing. Good afternoon, all. Myself, Dr. Anjana, Senior Consultant and Research Assistant at AVPRF, Coimbatore. Now, today I'm here to present on the Ayurvedic insights on gouty arthritis. Good afternoon, all. Myself, Dr. Anjana, Senior Consultant and Research Assistant at AVPRF, Coimbatore. Today, I welcome you all to on the discussion on the Ayurvedic insights on gouty arthritis. Many crystals are associated with articular syndromes. In practice, only monosodium urate monohydrate, calcium pyrophosphate dihydrate, calcium hydroxyapatite are commonly encountered. So, in short, we can understand that gout or gouty arthritis is a disease which is associated with crystals. So, the crystals which are commonly associated in articular syndromes are these, of which monosodium urate monohydrate is our topic of discussion. When we hear about gout, we come across a term called serum uric acid. When we ask the patients, usually they say that the only marker that is most aware to these patients are the elevated levels of serum uric acid. So we have to know what does this term serum uric acid means. Serum uric acid, it is the single most important determinant of developing gout. With normal renal function, its blood concentration mainly depends on the breakdown of nuclear proteins and dietary purine load. The aggravating factors or the factors which leads to an increase in the serum uric acid includes alcohol, dietary excess, surgery, trauma, sepsis, starvation, stress, dehydration, drugs like diuretics and pyrazinamide. So serum uric acid, as we all know, is a single most important determinant of gout. And these are some of the aggravating factors which leads to an elevated level of serum uric acid. Now, moving on to the term uric acid. Urate is the ionized form of uric acid present in the body. Uric acid is a weak acid with pH of 5.8. Urate crystal deposition in tissues starts to occur when serum uric acid levels rises above the normal threshold. Pathological threshold of hyperuricemia is 6.8 milligram per deciliter. So we can in short say that hyperuricemia is a condition where the serum urate level is greater than 7 milligram per deciliter in men and greater than 5.7 milligram per deciliter for women. So, serum uric acid is a weak uric acid with a pH of 5.8, and the increase in concentration of serum uric acid will lead to urate crystal formation, which get deposited in our tissues and lead to a condition called gouty arthritis. Hyperuricemia can be considered as a premonitory sign of this gouty arthritis. So hyperuricemia is defined as a condition where serum urate level is greater than 7 milligram per deciliter in men and greater than 5.7 milligram per deciliter for women. Concentration is greater than 6.8 milligram per deciliter. Urate can crystallize as MSU in and around joints. MSU crystals are released into the joint cavity, activate the synovial lining, recruit and activate the mastocytes and peripheral blood monocytes. So, we can say that in short, whenever your serum uric acid level is more, it leads to the formation of the crystals called MSUs. And these MSUs will get accumulated in your joint spaces, thus activating a series of inflammatory reactions. Organs such as liver, intestine, kidneys play a critical role at the systematic regulation of uric acid metabolism. Liver, intestine, and kidneys also plays a major role in maintaining the balance of our uric acid. So when we see that the uric acid pool is about 1200 milligram. From cellular breakdown, you get about 600 to 700 milligram per day. From it is excreted to feces at about 200 milligram per day. It is excreted through urine about 600 milligram per day. And the dietary purines, which contributes to this uric acid, is about 300 to 600 milligrams per day. So this is the normal metabolic state of uric acid in a human body. Now, we will move on to the condition called gout or gouty arthritis. Gout is the picturesque representation of uric acid disturbance. The term gout is derived from the Latin word gutta, meaning a drop of liquid. It was referred to as the king of diseases and the disease of kings or rich man's disease. So, as I said, gout is nothing, this elevated serum uric acid level is nothing but a premonitory symptom of developing gout. And this disease is important as its name suggests, it is known as the king of diseases and the disease of kings or rich man's disease. Gout is an inflammatory arthritis of metabolic origin that is caused by crystallization of MSU crystals within the joints. Also considered within the definition of gout is the spectrum of clinical conditions resulting from deposition of MSU crystals in the subcutaneous tissues and kidney manifesting as tophaceous deposits, inflammatory cellulitis, kidney stones, and so on. So, gout is nothing but an example of inflammatory arthritis. In gout, what happens is that there is accumulation of MSU crystals within the joints. Okay, so it can be considered as a disease which is purely of metabolic origin. And what happens with this accumulation of MSU crystals is that it leads to a series of inflammatory reactions in our body. Moreover, it also affects some of our other organs like kidneys, resulting in kidney stones. Now, we have to see the prevalence or the epidemiology of this particular disease. The prevalence of gout varies between populations, but is approximately 1 to 2% with a greater than 5:1 male preponderance. Worldwide incidence of gout increases gradually due to poor dietary habits such as fast foods, lack of exercise, and increased incidence of obesity. It is the most common inflammatory arthritis in men and in older women. So, from these data, it is clear that this disease is more commonly found in men. And the increased incidence of this particular disease can be attributed to our this modern lifestyle, food habits like fast foods, lack of exercise, as well as increased obesity. So these are some of the factors which has actually aggravated this condition. The risk of developing gout increases with age and with serum uric acid levels. Levels are higher in men, increases with age, and are associated with body weight. Other risk factors include metabolic syndromes, high alcohol intake, generalized osteoarthritis, a diet relatively high in red meat or fructose, or relatively low in vitamin C or coffee. So, as we can see that it is a disease which is more commonly found in men because of their no, more commonly found in men as well as older women also, and it is mainly attributed to our wrong lifestyle. And the main some of the factors which have contributed to the development of this particular disease are the alcohol intake, your diet, the diet which is high in red meat or fructose, and which is relatively low in vitamin C. Now, moving on to the causes of gout. Causes of gout can be broadly classified into three. One is the diminished renal excretion, one is the increased intake, and next is the overproduction of uric acid. So, in the beginning slides, we have seen that our uric acid pool. So, increased intake means increased intake of food which are rich in purine. That is one of the important cause of gout. And these foods include red meat, seafood, offal, and so on. Second important factor is diminished renal excretion. As we have seen that this metabolic byproduct should be excreted through urine. So whenever the kidneys are not able to perform this function properly, what happens is that there is an increased accumulation of this particular metabolite in the blood. And some of the factors which contribute the diminished renal excretion are renal failure, lead toxicity, alcohol, loop diuretics, low dose of aspirin, and so on. And the third factor is overproduction of uric acid. And this is mainly because of other systemic illness like psoriasis, high fructose intake, myeloproliferative and lymphoproliferative diseases. So, in short, the causes of gout can be classified as increased intake of purine diet, overproduction of uric acid, diminished renal excretion. Now, moving on to the pathophysiology of this particular disease. As it is clear that in gout or gouty arthritis, what happens is that there is an increased uric acid in your blood. This reacts with the sodium and it forms sodium crystals. And these crystals are called toffee. And these crystals we have already dealt with monosodium urate crystals. And these monosodium urate crystals or toffee get accumulated in your soft tissues and joints, and it leads to a chain of inflammatory reactions, which further results in the symptoms of gouty arthritis. Now, moving on to the classification of this particular disease. Hyperuricemia and gout may be classified as primary and secondary. Increased production of uric acid as a cause of gout is seen only 10 to 15% of subjects, and in 80 to 90%, uric acid excretion is impaired. So we can see that in a minority case, there is increased production of uric acid as a cause of gout is seen only in a minority case. So the basic culprit behind this disease is mainly the impaired excretion of this metabolite. Now, moving on to the clinical categories, that is primary gout and secondary gout. Primary gout can be either mainly because of enzyme deficits. Secondary gout can be due to other reasons associated with the organs. For example, chronic renal disease, inborn errors of metabolism, and so on. So, basically, gout can be classified into two, primary and secondary. Primary is mostly attributed because of those enzyme deficits, and secondary can be attributed because of the diseases of that particular system, that is chronic renal disease, inborn errors of metabolism, and so on. Now, what are the clinical presentation of this particular disease? The clinical presentation can be broadly classified into three: asymptomatic gout, acute gout, and chronic gout. Asymptomatic hyperuricemia, acute gouty arthritis, intercritical gout, chronic tophaceous gout. These are the four stages of this particular disease. Asymptomatic hyperuricemia. Hyperuricemia may be an incidental finding and may never lead to gout. Conversely, serum uric acid levels may not be elevated even during acute gouty arthritis. This is because of the ACTH released mechanism. Generally, asymptomatic hyperuricemia needs close observation with no active treatment. So, the first stage of gout is known as asymptomatic hyperuricemia. As the term suggests, it is clear that you may not have typical symptoms of gouty arthritis, but your serum uric acid will be elevated. But this doesn't mean that it will end up in gout. So, it is usually an incidental finding that your serum uric acids are elevated. And in this stage, it is better to control your serum uric acid with your diet and lifestyle, and no active treatment is required. Now, risk factors for developing gout in asymptomatic hyperuricemia are alcohol, meat, diuretics, beta blockers, obesity, hypertension. So, most of these factors can be corrected by you by changing your lifestyle. Moving on to the second stage, that is acute gouty arthritis. As you can see from the picture, it is clear that the big toe is the classical site for gout. Your big toe is the classical site for gout. One third of patients may get the first attack at another sites, such as instep of the foot, ankle, knee, or hand joints. Sydenham's classical description lists the important clinical characteristics used to diagnose a typical attack. So, in acute gouty arthritis, the typical finding is that your big toe is affected. The attack is acute. It starts in the night. The joint and surrounding tissues are swollen, hot, red, shiny, and extremely painful. There is mild fever with chills. Left untreated, the attack will start to improve in a week or two. The skin over the joint may subsequently desquamate. So this is the condition. This is in this stage we get most of the patients. That is in the stage of acute gouty arthritis. Now, what are the symptoms of this particular acute gouty arthritis? The typical symptom is that the pain usually starts in the night. And the joint, as you can see from the picture, it will be swollen, hot, red, shiny, and extremely painful. Associated with that, we will also have mild fever with chills. And if you're leaving it like that, it will improve in a week or two. Atypical manifestations are also seen in this condition, and this include tenosynovitis, bursitis, cellulitis, and so on. Acute gout in one joint may provoke migratory attacks affecting other joints, and this is known as cluster attacks. Polyarticular gout attacks are common in women, especially with diuretic use. So, as I said, the typical symptoms will be manifested in your big toe, but as days progress, you can find other joints also getting affected, and this is known as cluster attack. And despite that, you can also have atypical manifestations like tenosynovitis, bursitis, cellulitis, etc., associated with it. Now, moving on to the third stage, that is intercritical gout. After the first attack of gout, the second episode may never occur or occurs after several years. However, in most of the patients, next few episode occurs within 1 year. The frequency of attacks and number of sites involved gradually increases with time. So, in intercritical gout, what happens is that it is the period between the two attack of gout. It is known as intercritical gout. And in the second attack, it will not be like your first attack. Here, more number of joints or more number of sites will be involved. Next, moving on to the last stage or chronic gout or tophaceous gout. Development of chronic tophaceous gout depends on uncontrolled hyperuricemia of long duration, usually more than 10 years. But tophy or chronic polyarthritis may occur as early as 3 years or as late as 40 years after the first acute attack. Tophy appears as a firm, nodular, or fusiform swelling. In inflamed tophy, the overlying skin may be erythematous. So, in chronic gout or tophaceous gout, as you can see, there is a formation of tophy. And tophy is nothing but a firm, nodular, fusiform swelling. It is evident from the picture. Now, what happens is that this tophy or tophaceous gout get manifested only after a long duration of uncontrolled hyperuricemia, usually more than 10 years. In ulcerated toffee, white chalky material, the urate crystals may exude. The common locations of toffee are great toe, feet, hand joints, olecranon. Toffee of helix of the ear is also uncommon. So we can see that when the toffee becomes ulcerated, what happens is that you will have a white milky material which is coming out of your toffee, and these are nothing but your urate crystals. And the common locations of toffee are great toe, feet, hand joints, and olecranon. We can also, in some patients, we can also see toffee in the helix of the ear. Now, so we have dealt with all the four stages of gout. That is the acute gouty arthritis, asymptomatic hyperuricemia, acute gouty arthritis, intercritical gout, and chronic tophaceous gout. In the asymptomatic hyperuricemia, only a lifestyle changes is required. Most of the patients we get in the stage of acute gouty arthritis. Intercritical gout is the in-between period, and chronic tophaceous gout is the period where the toffee get manifested. Now, typical gout versus elderly onset gout. In typical gout, it peak in mid 40s. In elderly, it is over 65. Male greater than female in typical, and in elderly, male equal to female. In typical, usually I told you it is acute monoarthritis. That is one of the joints is involved. In elderly onset, it is mostly polyarticular. That is more than one joint is involved. Then toffee, several years of attack. In typical gout, as we have discussed, it will occur after several years of attack. In elderly, it may occur early. And the associated features of this typical gout is it is usually associated with obesity, hyperuricemia, alcohol, and so on. In elderly onset gout, it is maybe usually associated with renal insufficiency and diuretic use. Now, gout versus rheumatoid arthritis. What are the symptoms which distinguish between gout as well as rheumatoid arthritis? In gout, as we have seen, it usually affects on one side of body. In rheumatoid arthritis, symptoms can be seen in both sides of the body. In gout, the pain typically starts in the night. Whereas in rheumatoid arthritis, we can see that there is morning stiffness is a typical symptom of rheumatoid arthritis. In gout, uric acid crystals accumulation can be seen, which is known as tophi. In rheumatoid arthritis, no such symptoms can be seen. And in gout, it is usually associated with fever and chills. In rheumatoid arthritis, it is usually associated with fatigue. And it improves with gentle movements, but symptoms gradually worsen with time. That is a symptom of rheumatoid arthritis, where the symptoms gradually worsen with time. Okay, in gout, the typical symptoms and flare-ups occurs during your night hours. So these are the distinguishing features between gout and rheumatoid arthritis. Now, gout can also lead to some of the comorbidities. What are the systems which get affected with gout? It can affect your mental health. It can lead to heart disease and problems. As we have seen, it can lead to kidney stone, tophi, bone loss. It can deteriorate your skeletal system, sleep problems, insomnia, and associated symptoms. It can lead to diabetes. It can lead to kidney stones, and so on. So these are some of the comorbidities associated with gout. Now, what are the investigations that we have to do in a condition called gout? As we have seen, your uric acid should be evaluated first. So, diagnosis of gout based on hyperuricemia is a common misconcept among non-rheumatologists. Hyperuricemia is usually asymptomatic and does not necessitate the diagnosis of gout. This is very important. With hyperuricemia above 9 milligram per deciliter only, 0.5% of the patients may get gout. So hyperuricemia, though is an investigative parameter, it does not clearly states that you have gout. So with hyperuricemia above 9 milligram per deciliter, only 0.5% of patients may get gout. Although hyperuricemia is a characteristic feature of gout, it should be noted that during gouty attacks, serum uric acid might drop to normal levels. Hyperuricemia is a weak marker of gout diagnosis, and disease might still be diagnosed even with normal serum levels. So, in gouty arthritis, what happens is that either your serum uric acid levels can be normal, and still you have the disease. So it is mandatory to check this parameter, but the normal levels of serum uric acid does not 100% indicate that you doesn't have gout. Diagnosis of gout can be confirmed by identification of urate crystals in the aspirate from a joint. In acute gout, synovial fluid also shows increased turbidity due to generally elevated cell counts. In chronic gout, appearance is more variable, but occasionally the fluid appears white due to high crystal load. Between attacks, aspiration of an symptomatic joint or knee may still reveal crystals. So it is clear that in case of the critical stage also, if you aspirate the fluid, you can still find the crystals of monosodium urate. The synovial fluid is turbid with greatly elevated neutrophils. The synovial fluid should be ideally examined under polarized light. Urate crystals are needle-shaped, generally 5 to 25 micrometer in length, intracellular or extracellular in location. Urate crystals can also be demonstrated in gouty toffee. Hyperuricemia is confirmed if 2 or more fasting serum uric acid levels are elevated. This is important. Your hyperuricemia can be confirmed only when 2 or more fasting serum uric acid levels are elevated. Overproducer status can be determined by more than 700 milligram in 24 hours, urinary urate or a normal diet, or by single urine sample with increased uric acid or creatinine ratio. Assessment of your renal function, lipid profile, acute phase reactants like ESR and CRP are also essential in its management. Radiographs may be normal in early disease. In patients with recurrent attacks or chronic gout, radiographs shows punched out erosions with overhanging edges, mostly para-articular, asymmetrical. So radiographs are usually normal in early stage of the disease, but as the disease progresses, as I've told, it badly affects your skeletal system. So you can find findings in case of long-standing gout. Radiograph changes can be found after years, after about 10 years. During the early stages, it usually appears normal. Our biochemical screening of renal function, uric acid, glucose, lipid profile, everything is important. Along with that, we have to check our acute phase reactants like ESR and CRP. In chronic tophaceous gout, as we have discussed, the main radiographic findings are this MSU deposits, which can be usually seen in your joint spaces. And you can also find some of the joint erosions. Ultrasonography features articular cartilage double contrast sign is typical of gout. MSU deposits can be found. Doppler ultrasound can distinguish between active and inactive tophi based on their Doppler signal. Conventional CT is the best technique for assessment and characterization of crystal arthropathies. Dual energy CT can also be done. MRI is useful for evaluation of gout at unusual sites. So we can classify the investigatory parameters into your serum uric acid, your renal function test, your blood parameters like ESR and CRP, lipid profile, your glucose levels, then your radiographic findings, your ultrasonography features, and the conventional CT, which is the best technique. Now, diagnosis of this particular disease. Demonstration of urate crystals is the gold standard for the diagnosis of gout. Septic arthritis is an important differential diagnosis of acute gout. Sepsis may coexist with gout. With less classic attacks, other conditions to consider are psoriatic arthritis, reactive arthritis, and so on. So, the diagnosis can be confirmed by the presence or demonstration of urate crystals is the gold standard for the diagnosis of gout. Now, what are the differential diagnoses or the diseases which are misdiagnosed as gout sometimes? Soft tissue infections, other crystal arthropathies, Charcot joint, osteonecrosis, reactive arthritis, acute rheumatic fever. These are some of the diseases which can be considered as the differential diagnosis of gout. Now, moving on to the management of this particular disease, management of gout is directed towards the treatment of acute gout, prevention of further attack, identification and correlation of factors that contribute to the disease, weight reduction and reduction of urate concentration by low purine diet. So the management of gout can be the main goal of this management is you have to treat your acute attack of gouty arthritis. You have to prevent your further attacks. You have to identify the factors which contribute to the disease. We have to lead to since obesity is an important contributing factors. You have to go for your weight reduction. Moreover, you have to have a low purine diet to keep your uric acid levels at normal. Crash weight reduction programs should be avoided. High purine foods are red meat, liver, kidney, sardines, pulses, and whole grain cereals. If hypouricemic agents are used, pulses may be permitted. Beer, lager, port, and some wines should be avoided. Drugs such as thiazide, diuretics are best avoided. Associated disorders like hypertension, lipoproteinemia, etc. should be controlled. The drugs used are colchicine, NSAIDs, xanthine oxidase inhibitors like allopurinol, and uric agents. These are some of the drugs which are commonly used in the management of gout. Allopurinol is purely a uric acid lowering agent. In acute gouty arthritis, we can deal with colchicine, NSAIDs, or other corticosteroids. However, if the patient is already taking hypouricemic drugs, the same should be continued unchanged during acute attack also. A common mistake is either to start uric acid lowering agents or to change the dosage at such times. So, as we have seen, allopurinol can be used to lower your uric acid levels. In case of acute gout, you can go for corticosteroids or NSAIDs. And it is a common mistake that we perform in order to start managing this disease with the help of uric acid lowering agents. Now, principles of management, as we have already discussed, acute gout and recurrent or chronic gout. In acute gout, NSAIDs and colchicines. In recurrent gout, we have to reverse the factors promoting hyperuricemia, treat associated problems, correct your lifestyle patterns. These are the factors which are very important in order to prevent further attacks. Now, as we can see, your diet is very important in the management of gout. This is a table which will just enlist you some of the food which have high purine foods, moderate purine foods, low purine foods. High purine foods can be red meat, beef, meat extracts, sardines, meat soup, pork liver, beer, mackerels, etc. Moderate purine foods can be asparagus, beans, cauliflower, egg, milk, mushroom, oats. Low purine foods can be bread, cereals, fruit juices, nuts, fat-free cheese, and so on. So diet is very important in the management of gout. Now, moving on to the Ayurvedic perspective of this particular disease. In Ayurveda, this gout comes under a disease called Vatarakta, a condition where the Vata dosha vitiates your Raktadadu. And this particular disease can be broadly classified into two stages. One is Uttana Vatarakta and the other is Gambhira Vatarakta. Uttana Vatarakta can may be correlated with that stage of your acute gouty arthritis, and Gambhira Vatarakta can be correlated to a stage of your tophaceous gout. So what happens is that with all these nidanas in the sense all these causative factors like your improper lifestyles, improper dietary patterns, what happens is that it will impair your internal acne or the internal digestive fire. We will have a matter called ama, which is ama or undigested matter at your stomach, which further vitiates your acne, and it further leads to impairment of your rasa recta. That is, it will further result in the formation of vitiated rasa recta, etc. So this, in short, we can say that all your improper diet, improper lifestyle, everything, and moreover your this genetic predisposition factors, all these contributes to the formation of this particular disease, which may be correlated to a condition called Vadarekta in Ayurveda. Now, these are some of our stages where we intervene. Your Sanchaya stage, that means in our concept, every disease have a particular Kriya Kala. That is, Kriya means Chikilsa and Kala means a time of intervention. The time of intervention of this particular disease can be classified into six: Sanchaya, Prakopa, Prasara, Sthana Samstraya, Vyakti, and Veda. Sanchaya is nothing but the stage where you have increased acid production, decreased uric acid secretion. Prakopa are those factors which will aggravate the condition. Prasara may be correlated with elevated uric acid levels which circulate in your plasma. Sthana samstraya means it will leads to the target tissue damage, that is your particular tissue or joint damage. Vyakti means the disease get manifested, that is gouty arthritis. And Veda means it leads to a stage of complications like your tophaceous gout. So we can say that usually your correction has to be, you have to bring your changes in your lifestyle modifications should be both in your Sanchaya, Prakopa, and Prasara stage. Sanchaya means all these factors which lead to accumulation of uric acid should be avoided. Prakopa means all those factors which actually aggravate this condition should be avoided. Prasara means and in turn by avoiding all these factors you can in turn decrease the circulation of uric acid. Sthana samshaya means you might have reached a stage of acute arthritis which needs a specific or separate management. Vyakti, again we have to deal with treatments of acute gouty arthritis. And Beta is that complicatory stage where we need intensive therapies because you have already entered into a stage of complications. We have to treat the complications along with the Pradhana Vyadhi. Now, this is some of the correlations which we can find as similarities between gout and Vatarakta. In both cases, you have pain, swelling, redness, warmth, tenderness, formation of tophi, that is this curling of your joints and all. So, in Ayurveda, gout may be correlated with Vatarakta. Now, the Chikitsa in Ayurveda can be broadly classified into Nidana Parivarjana, Samprapti Vigadana, and Apatarpana. That is, this disease, which is called gout or Vatarakta, can be considered as a Santarpana Jani Vigara. That is, anything which is which has resulted which has resulted from your from your wrong lifestyle habits. So so the treatment mainly includes Nidana Parivarjana, that you have to avoid the cause that has led to the disease. Samprapti Vikadana means we have to block that pathogenesis. And Apatarpana means what you say, you have to eliminate all those toxins which is accumulated. So the management factors in Ayurveda includes Agni-diti, Amapachanam, Kapha-pitta-haram, Rakta-prasadanam, Dhatu-samya, Vyati-viparita, etc. That is, in Ayurveda, Agni is considered very important. Your digestive power or internal Agni is very important in the in the manifestation of all diseases. So the first level of management is that we should increase we should increase your digestive enzymes, or we should improve your your internal Agni has to be improved so that there is no formation of any undigested matter or ama. The second line of treatment is that since it is a disease which is caused by the vitiation of your recta has to be taken into consideration. That is, your recta should be purified. It should be made recta prasadana dravyas or recta prasadana medicine should be given. And the next is that we have to, since as we have seen, this is a disease which may progress to a stage of complicated phase. So it is very essential to prevent further attacks. So we have the role of particular rasayanas in this condition, which will help actually to prevent these recurrent attacks. So some of the formulations that we commonly use in Ayurveda are Kokilaksham Kashayam, Veeradaradi Kashayam, Guluchyadi Kashayam, and Grita formulations like Araskara Gritam, Tanvandra Gritam, Sukumara Gritam, Gulikas like Amrita Gugulu, Kaishor Gugulu, which actually helps to, Gugulu preparations actually helps to get rid of your pain, as well as they will, Kaishor Gugulu like things are very effective in for your management of Rekta Pradoshaja Vyadis. Then Arishtans like Saribadhyasam, Amrita Arishtam, Thailas like Pinda Thaila, which is very well known in the management of this, the pain associated with this, but the pain associated with gouty arthritis. Then we can use churnas like Shaddarnam, Sudarshanam, etc. to improve your digestive fire. Then, as we have seen, not only internal therapies, external therapies like Dhara, Lepam, Upanaha, all these are very effective in the management of this Vadrektam. So we can say that in our text it is said that Dashamula Kshiradhara, Dashamula Kshiradhara Sadhya Shula Nivaranam. That is, it is in a case of acute gouty arthritis where you have that much severe pain, you can actually do this Dashamula Kshiradhara, which will help to get rid of that pain. Moreover, application of Pinda Thailam, Vata Rekta Rujabaham. It is told as Vata Rekta Rujabaham. That is, it will also help you to get rid of that particular pain. Then you have Lepas or topical applications like Jana Mayadi, Ellum Nishadi, etc., which are found very effective. In addition to this, we can go for Snehapanam, Panchakarma procedures like Snehapanam, where we give medicated ghee for a particular days, and after that we will give your purgative therapy, which will further help you to remove the toxins and make your recta into in a proper state. Then again, again Vasti, which is said as our Artha Chikitsa, is also very important in the management of this particular disease. For example, we have Kshira Vasti, which is particularly indicated in Paitika Vadarekta or a Vadarekta, which may be correlated to that flaring up stage. A Vadarekta, which in which more of your Rekta Dhatu is vitiated, we can go for Panchatikta Kshira Vasti, which are very effective. And as I said, this is a disease which may progress to a stage of complication. So in order to prevent that further attack and in order to prevent these complications, we can go for Rasayana therapies. In this condition, we can give Rasayanas like Pippali Rasayanam, Vardhamana Pippali Rasayanam, and so on. So these are some of the insights into the Ayurvedic management of this particular disease. So in short, we can say that this particular gout can be maybe correlated with Vadrekta in our text. It has actually two stages, Uttana Vadrekta and Gambhira Vadrekta. In both stages, actually, we have a different line of management. For example, in Ayurveda, we have internal formulations which actually help to get rid of these symptoms, as well as Panchakarma therapies which help to treat the root level cause of the symptoms and also eliminate all the vitiated toxins from your body and further keep your Rakta Dhatu in a proper healthy state. And with this, I'm concluding my presentation on Ayurvedic insights on gouty arthritis. Thank you.